All right, welcome back. And on News Hub, we have a big discussion, like we always say. We do have big discussions, especially on Tuesday, where we have discussions around health. And this morning, we have Dr. Aleo Roberts here with us, a multi-decade public health physician, also the Association of Nigeria Health Physicians of Nigeria, isn't it?
Yeah.
Mixed it up there. But thank you very much. Always a pleasure to have Dr. Aleo Roberts join the conversation around healthcare.
Always exciting to come in on a Tuesday morning. I wake up like a little girl in a toy shop.
And yes, we are set to roll. And this morning we have a crack team also to join us virtually. Joining us via Zoom is Dr. Tunji Funsho, who is a cardiologist and leader Rotary Nigeria National Polio Plus Committee. They don't come any bigger than this. This is featured. They don't come any bigger than this. Just going through his profile, listed among 100 most influential people in the world by Times for last year. Just shows exactly how massive the work they did together with another guest I'll introduce later in taking polio out of the country and ultimately that dark spot in the African continent. Thank you very much for joining us, Dr. Funsho. Okay, we saw his visual. Okay, there he is. Thank you very much, Dr. Tunji Funsho, for joining us. All right, so we'll fix the audio. Maybe you unmute your device so we can hear you. And then we'll get back to Dr. Funsho quickly. We also have joined the conversation too, Ogechukwu Ochumba. Ogechukwu Ochumba is the winner 2021 International Service Award for a polio-free world. Thank you very much for joining us also too on News Hub. All right, she's a trained journalist and new media specialist, worked in several humanitarian projects. Thank you very much again, Dr. Roberts. And this discussion we're having today, focusing on the private sector and what they've done, and why the polio discussion also too was such a huge thing because of the collaboration between public and private. I think it's with the Covid-19 pandemic, this will provide a true test in seeing just what the private sector has done and can do further going forward from your point of view, Dr. Roberts.
Well, the truth of the matter is I must lay my cards on the table. And by the way, I notice I'm also holding a smartphone because let people not think that despite the several decades of experience, I'm a dinosaur from the 20th. But more seriously, I have to lay my cards on the table. I'm an ardent supporter of the private sector. I tell people I'm the very spoilt wife of a very successful private practitioner. So private sector has been very good for me. However, one does have to also look critically at the inputs that private sector has made to health systems locally and globally. Remember that, we in many of the low and middle income countries, we have this very mixed health system, formal and informal, state and non-state players. And in sub-Saharan Africa, private sector undergirds almost 50%, a little over 50% of the health system in various forms. And for good or for ill, we come up against them in very little things, up to the really big things. So, one has to remember the role that private sector played in 2014 to the Lagos State response to Ebola. Private sector rose in unity and concertedly, and it's completely changed the landscape where public-private sector participation is concerned, and showed that ultimately, until everyone is safe, no one is safe. So, I know we're going to recount so many instances by the time Dr. Funsho, comes on on the call, but we have to really look at several things that it's such a loaded conversation. Is it private sector principles? Is it private sector governance? Is it private sector profit? Because everybody just looks at private sector profit making, therefore it makes things unaffordable. No. There are governance principles, there are accountability principles, there are financing and funding principles. These are all things that can only benefit us in the long run.
All right, thank you so much. I say a lot of people are very excited to hear from Dr. Funsho this morning. Dr. Tunji Funsho, let's talk about the Nigerian health sector and the role that the private sector has been able to play so far, even before we get to the place of COVID-19. What's your overview of that?
I hope my audio is on now.
Yes, please. We can hear you loud and clear.
Great. Yes. The private sector has, as Dr. Roberts has just mentioned, the private sector has always played a very major role in our, healthcare sector, particularly in the curative healthcare sector. As you know, out-of-pocket expense for health in this country is a little bit more than Dr. Roberts mentioned. Most families, will cough out approximately 30%, of their income from time to time on healthcare. That is curative healthcare. But as far as public healthcare is concerned, there's a recent phenomenon that has been kind of given a lot of kudos by the Global Polio Eradication Initiative, which for the first time we had a huge global alliance of Rotary International, WHO, UNICEF, CDC, and the Bill and Melinda Gates Foundation, and in recent years the Gavi Vaccine Alliance, coming together to eradicate polio. Since that time, we've had a lot of other initiatives, that have come in to focus on specific areas, like malaria eradication, which the Gates Foundation is a very large contribution to. Guinea worm, eradication by the Carter Foundation. The Dangote Foundation has been very active, also in polio, but also in other areas, of public health. So a great phenomenon has started. I don't want to go into COVID-19 yet. I think, Dr. Alero is much more, qualified to talk about, Cacovax and Covax and so on. But it has spawned a new, how shall I say, movement in the area of not leaving healthcare to government alone. Because there's no way in the world that the government has been able to fund healthcare. Healthcare has usually been funded by contributions from the private sector, from individuals, either in form of direct taxes, or social welfare taxes, which is now plowed back into the healthcare of the individuals. So the way to go is where we are now. Gradually, we're coming to realize that, public health is the business of the, both the public and the private sector.
Absolutely. Thank you very much, Dr. Funsho, for the opening. And if we get to Ogechukwu Ochuba here, who is a lawyer and a journalist, has worked on several humanitarian awards. Ogechukwu, I'm sure it does disturb you too in your work also to something Dr. Funsho and Dr. Roberts points out, the out-of-pocket expenses for people, for the vulnerable people. In fact, we found out that people who are in the rural areas are spending more on healthcare than those who are even living in the urban areas, which shouldn't even be at all. What sort of lessons, since I know you did work with the polio eradication also too, you think with the private sector's collaboration, we can learn going forward with COVID-19? Ogechukwu.
Thank you. Thank you very much for having me this morning. I think basically the most important lesson is that knowledge that advocacy is so integral to our work as volunteers. I believe advocacy. Right now, a lot of people have wrong information as regards COVID-19, for instance, and it's the same thing we experienced with polio vaccination. A lot of people believe that they have adverse effects and all of that. I think it's our work as volunteers for me as a Rotarian and as a human being to convince the next person that it is required. It is required. It is something that doesn't have any adverse effects. The more people get vaccinated, the better it is for every one of us. So basically, advocacy is very important.
All right, thank you so much for joining us on the program this morning, Ogechukwu. Let's come back to the studios. Dr. Roberts, I know how passionate you are when it comes to, you said it, even though you're in the public sector, you really appreciate what the private sector does. But it will seem to some people that, especially in Nigeria, where 2/3 of the entire healthcare system, according to reports, are being catered for by the private sector, it will seem as if that the public sector isn't really standing up to its responsibility. How right am I on that?
Well, it's very difficult to see the aspects of support that, what the government does, because everybody looks at it and says, well, government hospitals have failed, PHC is not working, the doctors and nurses and other health workers are not being paid, and all we're seeing is a brain drain. But you see, if you don't have an enabling environment, there's nothing private sector can run away. You've got private sector, everything. You're looking at what Dr. Funsho is doing with what they're doing, and it all looks very good. But don't forget, private sector swings all the way across to quacks and charlatans. Who controls them? Who makes what they're doing illegal? So you've got government providing that platform, that the policies, the foundations, the regulatory agencies, and all that comes into what we call the health system. The health system is all the actors and participants, both state and non-state. So when somebody, like they said, in the underserved areas, somebody is badly treated or approaches an informal health worker, because anybody who works in health is a health worker, an informal health worker, and has a poor outcome, where do they seek redress? That's when they come back to the government regulatory agencies. And that's why, these are the parts that the public sector plays that people don't see. The fact that you've got access to any sort of health facility, it will not be ideal, perhaps, but the fact that it is there is a function of the public sector. Now, where the interface comes in, for instance, is that supplies, let's look at supplies and consumables as one area. Invariably, you find that supplies and consumables are private sector driven. The people who supply the drugs and consumables to the hospitals are from the private sector, because we don't have, you can't even have government putting hand down to the level of manufacturing drugs and consumables. That is just too much for any government to do.
Right.
So that is private sector. So you've got that interplay coming in there. But the quality of those drugs and consumables is a function of the public sector. So that people are not just pushing any rubbish out there, and you don't have any say in what you can or cannot buy. So there are so many, and I'm literally just scratching the surface. There's so much that the public sector and public administration and government agencies have to do to ensure that there's even a modicum of safety. So look at that, safety. So when you see a health facility, a private health facility, how do you know that it's safe? How do you know that the person who claims to be a surgeon is properly registered, properly trained and properly registered? How do you know that the nurses are properly trained and properly registered? You have to have some level of confidence that if so-and-so opens up a health facility, it meets the minimum standard for safety, for efficiency, for effectiveness, for everything. And that is where the public sector comes in.
Absolutely. And Dr. Funsho, something Dr. Robert says here, and I'm thinking, the other day I was listening to, well, it wasn't the other day actually, it was when the Covid-19 did break out, and then you had the Commissioner for Health in Lagos to talk about what the Lagos state government was doing, for example. And he was asked a question about how prepared the state government was. And he said, the worst time to prepare for a war is when the war is happening. And he went on to say that they hope that the lessons they get from the COVID-19 will help prepare us for the next pandemic, and more importantly, how to get out of this COVID-19. Do you think there's a clear path for the private sector, for example, to understand, like Dr. Roberts has pointed out, the gaps where the private sector can come in and help show up, or people are just left to their own whims and caprices in deciding where they can intervene in the health system?
Thank you. I think that's a very pertinent question at this time, particularly with regard to, COVID-19. COVID-19, caught everyone by surprise, and everyone who has been involved with, COVID-19 pandemic in any form, would tell you that information, knowledge about it was something that was changing virtually on a day-to-day basis. We could have been better prepared, but then even countries, that were a little bit more prepared were still being met, with surprises. One of the areas that I think we need to work a little bit harder is the area of, communication. I always, use my polio template, because when we are addressing issues that has to do with public health, we don't tend to plan with the people in mind and with the people coming along. I always, quote the adage of you cannot shave a man's head in his absence. No matter how excellent your plans are, for a health intervention, if the final beneficiary does not understand why you're doing what you're doing and you want to get them involved, it's going to be very lackadaisical about it. And we've seen that, quite a lot, with COVID-19 in particular. We need to communicate with people in the language they understand. By that I mean various parts of our communities, have different fears, they have different aspirations, they have, various influences, on their decisions. It may be their religious leaders, it may be their traditional leaders, it may be their local influencers. Our communication should be based on those, kind of differentiations. But we tend to have just, one track. We go on radio, we go on television, and we speak one language to people who understand different languages. So communications is very vital, for any kind of intervention. Creating an awareness in the public is also very important. And we need to use people, public. When I say the public, I mean the average, citizen on this. People they have trust in, to give them information, particularly when there are so many kind of information about the same subject that is available to them, either through electronic media, but more importantly in recent times through social media. So we need to have communication tailored towards different groups, so that the person you're trying to reach buys into what you're trying to give to him.
Much, Dr. Funsho. I just imagine that we now have to delve into the issue of COVID-19. We've been able to lay the foundation for what the private sector really stands for in the country. We've tried to do that. Once again, let me congratulate you, Ogechukwu Chuba, on your win as the 2021 International Service Award for Polio-Free World. Congratulations for Africa. Congratulations again.
Thank you. Thank you.
All right.
Thank you very much.
All right. Now let's see if we can compare what's been done in the area of eradication of polio, which Nigeria got out of. We were very happy. Then another case came. We were very worried. And now we think that we have it, hands-on in the country. Let's compare the efforts of the private sector, in ensuring that this feat has been achieved in the country, vis-a-vis the efforts of what it would seem not really evident in the private sector-driven society as ours in the fight against COVID-19.
Well, I think that, like Dr. Funsho said, the template isn't quite that different. what we should be doing and what we have done so far just shows that we need to do a lot more. The template isn't that different in the sense that we're still dealing with people. It's a pandemic right now. The polio disease is also something that affects people. So generally, I would say it's the same. The template for managing both isn't that different. Like Dr. Funsho said, you should speak to people in the language they understand. A lot more needs to be done. It's easy for us to be on TV, be on radio, on social media, but the truth is that a lot of people
I think we have some difficulty in hearing what you have to say now. I'd also like for you to answer the question, but let me pass it back to Doctor, before we come back to the studios, Dr. Funsho, same question comes to you. We have a platform, a template with which polio has been dealt with by the private sector in the country, which seems to have worked. You also won an award. You are not just an award winner, you are listed as one of 100 persons in the world by Times. That's a great feat. So when you take a look at that and what seems to be going on in the fight against COVID-19, which many people see only government, some people can only see government, they can't even really see what the private sector is doing, especially in the country. What should we be doing at this point in time?
I think, the challenge we've had, with COVID really is that we've not had a coming together of the group like we had for polio, which started in 1987, which was brought into by almost 180 governments of the world through the World Health Assembly. The COVID effort has been quite segmented. I mean, you can see at various levels, at the political level, red flag nations, amber flag nations, travel bans, and then we have vaccine inequity. I mean, if we had something like we have with the GPI, which involves, most of the countries of the world, WHO, UNICEF, with Rotary playing a critical catalytic role. We have, as Rotarians, since 1987, made polio eradication our #1 priority project. So we keep knocking at doors, the doors of governments, across the world, even governments that have not seen polio for more than 2 decades. We keep knocking on doors, of donor agencies, and that is, how we eventually got into this financial partnership with the Gates Foundation, matching every dollar we spend on polio with $2. We keep knocking on doors of the caregivers and guardians. One of the areas, that Rotarians have worked hard is to be able to interact with the public who are the final beneficiaries and give them confidence in both the safety and the efficacy of the polio vaccines. Despite a lot of negative media, that occurred as part of the challenges we had, for polio eradication. So it's the need to have, a body like the GPI that meets regularly, that has different subcommittees looking at different areas, be it, vaccine production, vaccine logistics, cold chain, system, operational, manned by experts, so that everyone is speaking with one voice on just this one project. I think that is one fundamental thing that has been lacking in our COVID, efforts. Everyone has been doing, as they say, their own thing. And therefore, you will find us are sometimes, working at cross purpose, with one another. I think, that is one of the pitfalls of our efforts, towards, putting the lead on the COVID-19 pandemic. Even in this country, if you recall, some states, did not want to have any labs, in their states. Some states said they don't have, COVID-19, and so on and so forth. So when you have that kind of, scenario sending different signals to the public, then things are bound to be chaotic. And I think that is part of what we have faced with, the COVID-19 pandemic in Nigeria and in the world in general. But eradication of polio, because we had, a structure on ground, that ensured that there's regular meeting of the mind, we have been able to get this far with the polio eradication. There are just 2 countries, Afghanistan and Pakistan, with polio. And even they have had a marked reduction in polio cases from 140 in 2020 to just 5 cases last year. Even those 5 cases are 5 cases too many. Our ambition is total eradication of polio from the world.
Total eradication, and we do thank great people like Dr. Funsho for which is exactly how it was described. Pakistan, Afghanistan, India, Nigeria, but Nigeria no longer part of that pain. But Dr. Roberts, something Dr. Funsho says, and I think also Ogechuku reiterating the fact that for a long while people have focused on the private sector's involvement, mainly thinking about the money and the financial intervention rather than communication, which obviously from what they've pointed out with the polio example and also with the COVID, we've seen that communication perhaps would have saved us a lot more time and maybe resources eventually. But I don't know what you also think, maybe share on that one, and also in terms of the financials also too. We saw what's happened with COVID and the money that was pooled and this sort of futuristic as well as the immediate goal of what they could do with the monies that were thrown into that pool to help in dealing with COVID.
Thank you. You see, one of the things that, you know what is said, the reward for hard work is what?
More hard work.
More hard work. So I think, as Dr. Funsho was talking, I was sort of thinking, is there any other private organization like the Rotary International? And I really couldn't think of any in the last few minutes, because you see, there's one thing that we have to take notice of with an organization such as Rotary International. They are everywhere, they are trustworthy, they are men and women of integrity, and they can, as he said, communicate with their community, because in their community they have huge trust capital. My father is a Rotarian, so I know, in the community where he works, he was a trusted person. So when Rotary International take up something like polio, which of course they've done since forever, 1987, when they are talking, they are not talking polio, government, they are talking to me and you. And they are people we already know and trust. So that issue of communication is actually key. Of course, the Association of Public Health Physicians of Nigeria, what is our main role? Communication, community engagement, risk communication, educating people, addressing their anxieties and concerns. If you don't reach down to the least stakeholder, you will never build consensus. And that is what is most important. So when you're looking at the financials, one of the major areas that I'm sure even Rotary International cannot quantify in terms of dollars and cents is that the cost of that communication. Because that would have been their major expense in terms of time, in terms of effort, in terms of finances, actual money going out, because they would have had to go everywhere and communicate with people and build awareness and build consensus and address concerns. That is so vital. So I'm thinking, if we were to replicate that model with COVID-19,
yes.
Is there another private organization we can approach? Sadly, I don't think so. Because like Dr. Funsho said, the template is already there. Is it perfect? No. We're human. Nothing will ever be perfect where human beings are concerned. But it's certainly a lot better than anything else that's in existence. And the important thing is that you need to have a private organization that is not government, not religious, not political, not national, not. It's everywhere. It's literally like the water or the engine oil in an engine. It's just everywhere, oiling and you've got Rotarians in government, you've got Rotarians in private sector, you've got Rotarians everywhere, and that is actually key. So even if they were to take up, say, the communication and advocacy issue, let's face it, they're already experts at it.
Oh.
They are already experts at it. And you see, and when you're talking financials, everybody thinks, oh, the dollars and cents that are spent. No, there's a lot more financial capital that is social capital that needs to go into place, that you need to have people there to be able to put
I'm going to stick with you, Dr. Roberts. I remember that at the peak of COVID-19, we had COVID. We're not really hearing from them again in the country. You know, the group of private sector driven people have businesses putting resources together, ensuring they put palliatives in place for Nigerians to really cushion the effects of the lockdown there. And afterwards, we also heard that as individuals, they're trying to put resources together to get vaccines for the country. Because if we talk about COVID-19, the main challenge that Nigeria and some countries are faced with right now is availability of vaccines in the country. Thank God Greece also gave us another 1 million jab of doses of J&J. Thank you, Greece. God bless you more. Where do you see this going in the country? Because I hardly hear of anything like that. Are there people in the private sector doing things that we don't hear? Because one would have thought that the way and manner at which COVID, started out in 2020, that they would have even gone further than this in helping with the main issue, which is about vaccination in the country.
We missed a very important point that Dr. Funsho said. You see, something like the JPEI, the Global Polio Eradication Initiative, Rotary was probably the starting point. But look at how wide the coalition was, with WHO involved, with the Bill and Melinda Gates Foundation involved, with it was everybody was involved. And then listen to what he said. They are still meeting. So there's structure. There's structure. There's policy. There's monitoring and evaluation of implementation. There are some certain key things that private sector is incredibly good at that needs to go on. You see, nobody can spend JPEI money without there being a consensus on what is being spent, what is being spent for, and how they're going to measure the impact of what is being spent to do. That sort of structure needs to be in place. That's why I said the reward for hard work is what? More hard work. Because let's be honest, even our 93-day wonder for Ebola was based on the polio templates. Many people don't know that. They literally changed the polio template that was already in place in Nigeria and said, right, let's apply it to Ebola. So that's where people got to hear about emergency. I didn't know about Emergency Operations Center before 2014. But it was there. It was a process, a platform, a strategy that already had structure. And we simply moved it from polio temporarily, applied the same principles in Ebola, boom, we're talking 93-day wonder. And now, with the same thing we've employed for COVID-19, Emergency Operations Center, right, well, what are the pillars of this EOCs, who are the players, and so on and so forth. And we've used that template, admittedly, very successfully. Are we out of the woods yet? No. COVID-19 is a completely different disease from Ebola. But we have used it successfully. And it's something that, as Dr. Funsho said, the template is there. The processes, we know what to do. We just need the wherewithal to do it. So it's something that I'm hoping. Am I making a shameless plug here?
No, you're hitting the nail on its head, so to speak.
Let's go back to Ogechukwu and let's hear what she has to say. She's been in the woods, which is why she picked up on the web. I don't know if she's still there. We had some issues connecting with her, but Ogechukwu, are you still there? All right, I don't see her, neither do I hear her. But we'll connect with her. But Dr. Funsho is still there, so we'll speak with Dr. Funsho still and then hear some more. So Dr. Funsho, we have a template. We have many things going right for us, but there's something you mentioned, which I think it's the way out for COVID-19 for the entire world, including Nigeria, where even the WHO says that we hope by the end of this year we'll be saying bye-bye to COVID-19 as a pandemic, he says, Dr. Theodoros Ghebreyesus. Well, what would you say in terms of vaccine equity, which is a key issue here? We're still very far from the mark. We're just about a little over 10 million vaccines for a country of over 200 million, adult population over 100 million. What can the private sector do in your own opinion?
Well, I have been riled about the vaccine inequity, not because we're not getting enough vaccines to get to a point where we have what we call herd immunity, but even countries that have reached herd immunity soon discovered that vaccine inequity has made their herd immunity useless, because when viruses are allowed time to keep transmitting, by giving those viruses time to have more mutants. We've just been lucky. As a matter of fact, I've had just 2 major mutants that have caused a lot of havoc, Delta, Omicron, and we hope the new one that has just been discovered in Europe, EHU, would not be a devastating one. As long as there's transmission of a virus, we've seen that even with polio, as long as a virus has the opportunity to find human hosts to be infecting over and over again, and knows that its life is threatened, nature has given it the capacity to mutate so that it can survive. So I'm not as optimistic, as WHO Director General, Dr. Tedros, that the end of this year, I doubt very much whether he would have said that, because as long as the majority of the world, which is the situation we are in now, have not been vaccinated, the virus, that is the COVID-19 virus, is having a lovely opportunity to have breakfast, lunch, and dinner in our system, in our communities, will continue to mutate, and the vaccines will stop being as effective as they are. That is why you find us having boosters now. Some countries like Israel are having the second booster, which is the 4th dose, and I'm quite certain this is going to be like most vaccines that ab initio we've been given to children. Polio is 3 to 4 doses, for instance. The tetanus vaccine is also a multiple vaccine, because we need to keep boosting immunity. In the case of COVID-19, the appearance of mutants will continue as long as there are parts of the world with very, very low immunization coverage for COVID-19. And as long as that be the case, the current vaccines are not going to be as effective as they are against the original, COVID-19 virus, because as mutations occur, the more, the less your immunity is going to be able to deal with the virus. And so even if you've covered your population, 80% of your population has been covered with the vaccine, when a mutant comes, you are literally back, to square one. Particularly in the Western world, we all know what is happening in the United States and Britain, Germany and France, for instance, that have had reasonable high coverage, up to 60%, in some cases more, and still having their hospital beds full, and even the military being called in to assist, because of loss, of medical staff. So vaccine inequity is not been a smart thing on the part of the developed world, because at the end of the day, they're shooting themselves in the foot. Because as long as there's, COVID-19 circulating, amongst unvaccinated, individuals, the more variants will occur, and the more useless the vaccines are going to be. So we need to ensure that there's equity in vaccine distribution. It's in the interest of the world, for there to be vaccine equity. Thank you.
Thank you so much, Dr. Funsho. Let's now get back to Ogechukwu Chuba, who thankfully we've been able to restore connection with you again. Now let's look at your experience as a volunteer in the fight against polio and see how this can work in the fight against COVID-19. Have you seen any correlation in this? Oh, all right. I think we can see her, but we have to reestablish the audio with her because I want to imagine that she should be able to respond to that. Are you there, Ogechukwu? All right. I hope that I'll be able to talk to her and hear her view on that. Let's come back to the studios. Dr. Robert, one of the things that made news at the height of COVID-19 when there were, centers set aside for, people to be cared for, was the call for the private sector to be involved, such that if, for instance, those isolation centers were overwhelmed, then the private sector could take up, the care for the people down with COVID-19. Where are we with that when you talk about the private, generally, especially in Lagos, private sectors now involved in caregiving to COVID-19 patients?
We didn't have that many. We did not have an overwhelming number of severe cases that needed hospitalization. And one has to keep remembering that when you set up those kind of centers, staffing is an issue. How long do you continue to retain the staff for? What is their career pathway? Are you going to provide them with the source of income, with the source of income, and for how long? So there was an initial 3 months, if I am right, which was extended for another 3 months, and then suddenly they were all let go. How do you get those members of staff back? Equipment, who maintains, drugs and consumables, who pays for the supply chain? So there's a lot more to setting up an isolation center than merely putting up a tent, air conditioning it, and coming to cut a ribbon. And people we must understand that health facilities are not just pretty marble and glass structures. You've got to have the manpower, you've got to have the materials, you've got to have the finances, the money, you've got to have the training. It has to be based on evidence, so you have to have the research to put it all in. So who was it who said that you cannot, the health commissioner said, you cannot plan for a war the day the war breaks out. All these things need to be in place first, and these are some of the areas that the private sector has been actually doing very well on the ground, behind the scenes, supporting the government to make sure that these things are in place. We've got foundations coming up, even a new one that started the other day, funding people to go to school. So that is very important. We've got people who are being given scholarships to go into the health sciences, into biomedical engineering, because everybody forgets you cannot have health sciences without having biomedical engineering. This thing we're talking about, communication and advocacy, without a strong primary education system, where do we even begin to start teaching people from youth fundamentals about disease causation and prevention? So these are things that private sector has already been. I know a particular bank that has been supporting private education, primary education for decades, So these are things that need to continue. They need to be, perhaps we do need to even celebrate it a little bit more. But more importantly, I think one of the key things we're also forgetting, so we've talked about advocacy, Mrs. Ochuba talked about that. We've talked about communication. Another thing we need to be talking about is research, getting the evidence. What cannot be measured cannot be improved. So we need to be able to measure, monitor, and evaluate the impacts of what private sector involvement is doing in Nigeria, so that we can see the gaps that are being filled. So that's where the government comes in. The government would have an agenda and say, okay, these are the plans, this is what we want to achieve, this is where we want to go. And the government agenda will be based both on evidence, what I call scientific clinical evidence, and the evidence of the people's values and beliefs and belief systems and ideologies and so on and so forth.
Okay.
All that has to be brought together. And you, as a private sector player, because Silverbird is a private sector player, has a key role to play in this, media and communication.
Absolutely. Dr. Funsho, something that Dr. Roberts talked about, and something we've been talking about for a number of weeks here on our different shows in terms of different sectors, has had to do with a lot around research. If it's agriculture, we hear great brains, there's a lot of work going on with the research institutes, but you hear from NAFDAC saying, okay, we're going to stop the importation by a certain percentage because we think we're now self-sufficient. But something we found out is that in terms of scale, it remains a problem. If you have just one unit, it's okay, but then a country of Nigeria's size will require a chain where the scale will mean we have a production chain rolling out these things in numbers that can cater for the numbers of people. And this is where I ask, in terms of the private sector, why it's difficult in your years of experience for the private sector to get into the production workshop and say, let's scale these things according to Nigeria's population, and especially around medical health, and stop the importation of the inputs we see in the health system.
I think sadly, in our own, situation, public health planning is the exclusive forte of government. As I said earlier, you cannot shave a man's head in his absence. It's for the government to set out, a public health policy, which is supposed to be long-term, that private sector can buy into and support. As far as I know right now, we have at various times, depending on who is on the helm of affairs, we have different trusts, in our public health policy. We for instance, during the tenure of Professor, Isaac Adeole as minister, we had this very great idea of, the 10,000 primary healthcare centers project, which was aimed at ensuring, that you have a primary healthcare center virtually in every ward or every other ward, which would be funded by government. I recall that we had some communication with the government at that time to give us a blueprint of precisely what these health centers are supposed to look like, where are they going to be located, so that we can advocate, for funding for some of these, projects. Up to the time he left office, we were not able to get this out. That is part of the constraints of the private sector going into the public health sector space. The government has the exclusivity of planning for public health, in my opinion.
We have to go.
Private sector can now buy in as partners. It's happened with polio. For instance, the Gates Foundation and the Dangote Foundation have a partnership with I think it ended up about 11 of 12 state governments in the north to support routine immunization, build health centers, help with staffing, and knowing these two organizations, they have regular meetings with state, governors. Even during, COVID pandemic, they were having online, regular meetings to assess how far we have gone. They provide some funding. The state governments have counterpart funding, which is a very tiny percentage of the whole amount. So at the end of the day, the government needs to set an agenda for public health.
All right.
And seek private sector buy-in.
All right. Thank you so much, sir. Before you go, in just 10 seconds, if you can, is Rotary planning something towards helping out in the fight against COVID-19? If you can do this in just 20 seconds, Doctor.
I didn't get, the...
Is Rotary doing something to help out in the fight against COVID-19 in the country?
Yes, I mean, one of the first things we did, when there was lockdown, was actually right across the country, providing palliatives for those, who have been unable to go out and earn a living, which helped tremendously a lot of families, to stave off, hunger, at that time. I participated in some of them, and we did this right across the country.
All right.
Other areas is in the areas of advocacy, because we also, supporting the issue of, trying to ensure, that, vaccine equity, does occur. I mean, that is the only advocacy role that we can play at this time.
All right.
We're not putting any funds into vaccines at this time.
All right. We want to thank you so much, Dr. Tunji Funsho, cardiologist and leader of Rotary Nigeria National Polio Plus Committee. We thank you so much for your time and thoughts on the program today.
Thank you for having me.
All right, so you're all smiles. It seems to me as if you enjoyed every answer that the doctor provided and all of that.
Do you know what an honor it is to even be in the same space as Dr. Tunji Funsho? To be honest with you, I mean, come on. This is not just talking. This is walking the talk. This is, I mean, because when those of us in the public health space, we are so tired of the talk, that, to see people and to meet with people and to be able to work with people who don't just talk, but actually walk the talk is so refreshing. It's so invigorating. It's so encouraging. And more hard work, but at least, the beauty is that there are templates that we can work with. We're no longer walking in the dark. We're no longer just experimenting. We've got strategies and processes that work. We just need to have the wherewithal to do it.
Absolutely. Thank you very much. It's always a pleasure having you, Dr. Alea Roberts, join the discussions on Health Tuesday.
Thank you for having me.
Dr. Roberts, the public health physician of several decades. It's a pleasure to always have her. So the Association of Public Health Physicians Nigeria, thank you very much, ma'am. Absolutely. And Ogechukwu Chuba, thank you very much also too. Journalist as well as a lawyer, advocacy with polio, and an award winner also too for her work with taking out polio from the country with the Rotary International. Let's take a quick break, and we come back. Dr. Abayomi will be joining us to talk about uterine fibroids and how to have it done without going through the knife and all of that. Please stay with us on News Hub.